Breaking barriers, building bridges, SADC's commitment to equality and HIV. Eradicating HIV by 2030 is a global target championed by the United Nations Political Declaration on HIV and AIDS. To meet this target, the 2025 Global HIV Prevention Roadmap specified HIV targets that address the 10-10-10 societal enablers to HIV response. But what are 10-10-10 targets for societal enablers? The 10-10-10 targets state that by 2025, less than 10% of countries should have punitive legal and policy environments that deny or limit access to services. Additionally, less than 10% of women, girls, and people affected by HIV should experience gender-based inequalities and sexual and gender-based violence. Lastly, less than 10% of people living with HIV and key populations will experience stigma and discrimination. Discrimination and stigma associated with HIV has caused inequalities that hinder an inclusive fight against the pandemic. This goes against the core principle of the 17 Sustainable Development Goals and the AIDS response, which states that no one should be left behind in national, regional, continental, and international HIV response efforts. However, key populations continue to be left behind, facing various challenges and barriers that impact their vulnerability to HIV. These challenges include stigma and discrimination, criminalization and legal barriers, limited access to healthcare services, socio-economic factors, and negative portrayals in the media and communications. So, who are key populations? Key populations are groups of individuals who, due to specific higher risk behaviors, are at increased risk of HIV. Traditionally, key populations include people who inject drugs, sex workers, men who have sex with men, transgender people, people in prisons and other closed settings, including adolescent girls and young women. The SADC region recognizes the importance of addressing the specific needs of key populations in HIV response. It has adopted specific commitments that serve as benchmarks relating to different governance areas that directly concern the protection of key populations. One of the commitments is the SADC Parliamentary Forum Minimum Standards for the protection of the sexual and reproductive health of key populations. These minimum standards provide guidance and support for parliamentarians across SADC on their role to protect the sexual and reproductive health of key populations. The other integral commitment is the SADC Regional Strategy for the HIV Prevention, Treatment and Care and Sexual and Reproductive Health. The strategy aims to decrease the number of people living with and affected by HIV and AIDS in the SADC region, with a focus on key populations. It advocates for the development and implementation of laws and policies that protect the rights of key populations and calls for the expansion of evidence-based prevention interventions tailored to their needs. The other guiding commitment is the SADC Strategy for the Sexual and Reproductive Health and Rights in the SADC region 2019 to 2030, which provides a comprehensive framework for addressing the sexual and reproductive health needs for individuals in the SADC region. It emphasizes accountability, collaboration, and partnerships to improve sexual and reproductive health and rights. At a global level, but still relevant to SADC region, is the United Nations Political Declaration on HIV and AIDS, which aims to end the HIV/AIDS epidemic by 2030 and address the persistent inequalities that have hindered progress in the fight against the disease. It provides a framework for international cooperation and a roadmap for action. So why these commitments? As the SADC region and the rest of the world are on the road path to end HIV by 2030, there is a need to leave no one behind. Understanding and engaging the SADC's key population-specific commitments is essential to promoting the human rights and dignity of key populations. These commitments address structural and legal barriers, promote meaningful participation of key populations, and provide a framework for monitoring and evaluating the HIV response. The commitments also serve as guidance and support for various stakeholders across SADC in their roles to make interventions in their diverse constituencies and levels for the protection of the SRH of key populations and for ensuring that all individuals in member states achieve their right to health. Although there has been progress in some countries in the region, we call upon governments, civil society organizations, international and regional organizations, healthcare providers, and communities to play their respective roles in the protection and promotion of the rights and well-being of key populations. SADC member states should uphold and translate commitments into concrete action to address the needs of key populations in the region, including men who have sex with men, transgender people, sex workers, adolescent girls and young women, and people who use drugs. Stand with us in solidarity. Join the movement for equality and a world free of HIV. Together, we can create a brighter and inclusive future for all.